what is the prevalence, or how many people have paruresis? Well, the numbers are all over the place. And from the very beginning of our organization, we settled on the figure of 7%. And we got this from a measure on something called the National Comorbidity Scale, which asks the question, do you have trouble going to the bathroom and urinating away from home? And roughly 7% of people responded affirmatively. So that is a rough gauge. If that was anywhere near accurate, that would mean roughly 27 million people in the United States suffer from paruresis, making it probably the second biggest social anxiety disorder next to the fear of public speaking. There's also now some data from a global study that was done on social phobias in about 8 different countries. And based on the question asked about having trouble using the bathroom away from home, essentially the conclusion was, if you average the numbers, that roughly 3% of the world's population, or close to 220 million people, could suffer from paruresis around the world. I don't think it's evenly distributed. I think there's a bigger problem in some countries than others, and some of the other data seems to indicate that. So we have some rough numbers, but clearly more robust measures should be done to really assess the scope of paruresis and its severity in different countries. And of course, people's symptoms can range from anywhere being very mild to being very severe. So now I'll talk about theoretical perspectives that inform our understanding of paruresis. And I'm just going to mention 3, put some together to give you a sense. There are more covered in the book, of course. But the first would be a biological perspective, and to simply say that this is a person, or more broadly speaking, an animal's response to anxiety in a fearful situation. And the bladder will shut down in those cases. I'm fond of giving my saber-toothed tiger analogy. If you're running away from one, or our ancestors were, then the last thing you want to be doing is peeing and leaving a trail behind you for it to be followed. So it's natural that the bladder would shut down, more energy would go to your legs so that you could run faster, and you wouldn't feel any urgency to go to the bathroom. There's also probably a heritability factor here. There are some twin studies that indicate this, so that one may have certain genes that were passed along from parents to children, and then from those grown children to their children. And that link could be another key to understanding paruresis. The second perspective I'll mention is what we'll just broadly call the psychoanalytic perspective. This was developed probably in the 40s, most notably by Carl Menninger. And again, some of the factors I mentioned before, such as the unconscious association of urination and sexual activity, repressed anger, a passive-aggressive defense mechanism, could all play into this, as well as the issue of sexual abuse. And there certainly are cases of this. How widespread, I don't know, but I do not think that it's the primary cause. The last theoretical perspective that would be helpful is the cognitive behavioral framework. And here we would look at paruresis as having been caused by a traumatic incident and a phobia developing, let's say, as a response to classical conditioning, and then over time reinforced by one's thoughts, feelings, and behaviors toward using public bathrooms, essentially avoidance behavior after the incident and not using the bathrooms, which can simply keep making the problem more and more difficult. So what are the implications for these perspectives for treatment? Well, in part, if it's seen as biological in nature, then one would probably look for surgical options. And there are certain procedures that can be done, from probably the least invasive being what's called a mini tunt or transurethral resection of the prostate with microwave therapy. And there is some evidence that this can be helpful to some people in helping relieve the symptoms of paruresis. The most extreme example would be for people with prostate cancer, the removal of the prostate. And again, there are reports that when this is done, that it helps people with their paruresis symptoms in some cases. So that is one way to approach dealing with paruresis. There's also other kinds of treatment, but again, they're covered in the book. If we take the psychoanalytical, psychodynamic point of view, then we look at what's been done in that area. And quite frankly, there are a couple of case reports in the literature of this approach being helpful, mostly quite a long time ago, to some patients. But since psychoanalysis in general is less in favor these days, and there is clearly no strong evidence that it's helpful, the third perspective, the cognitive behavioral forms of treatment, seem to be our best option. These began in the 1960s, and what we've found, and we certainly use these in our workshops, these techniques, is that graduated exposure therapy over a period of time seems to be the most effective approach for treating people with paruresis. And essentially, I would say that roughly 80-90% of people have some or significant improvement using these techniques. The big question from our point of view these days is, are there other methods that can be used in conjunction with CBT therapy to help clients? And the answer is probably yes. And this would be the adjunct use of medications. We have a long section in the book about what anecdotally has helped some people or not. And so just basically, and I'm not a medical doctor, but we have found that the selective serotonin reuptake inhibitors, or SSRIs, and the benzodiazepines like Valium and Xanax can be useful to people in their treatment of paruresis. I should mention that there are other techniques as well that we have discovered over time, from the most invasive approach, but probably the most effective, which would be internal or external self-catheterization. This seems to help a number of individuals, especially in difficult situations like traveling by plane or train or even car. More recently, there's what's called the breath hold technique, and there's a lot of information about this on YouTube and demonstrations by some people who have attended our workshops and others who show how to do it. And lastly, and most recently, the adult diaper approach, which allows you to essentially, I don't want to say pretend, but imagine that you have no control over your urination functions and simply pee in your pants. And this works, again, for some people.